What is the difference between dry drowning and wet drowning? Have you ever wondered what happens in the body during a drowning incident? Understanding the difference between dry drowning and wet drowning can be important for anyone who enjoys boating or spending time near water. Let's break it down in simple terms. Wet drowning occurs when water enters the lungs after a person inhales water. This happens when the laryngeal spasm, which is a reflex that closes the vocal cords to protect the airway, relaxes. When this occurs, water can flow into the lungs. This can lead to severe breathing problems and a lack of oxygen, which can be life-threatening if not treated quickly. On the other hand, dry drowning is a bit different. In this case, the laryngeal spasm does not relax, and no water enters the lungs. Instead, the vocal cords stay tightly closed, preventing air from getting into the lungs. This can cause breathing to stop, even though the lungs are dry. Dry drowning accounts for about 10 to 20% of drowning cases. While no water is in the lungs, the lack of oxygen can still be fatal. When it comes to boating and man overboard situations, the key takeaway is that both types of drowning requiring immediate action. The most important thing is to restore oxygen to the victim's lungs, regardless of whether it is dry or wet drowning. First, it should focus on getting the person out of the water and ensuring their airway is clear. If necessary, rescue breaths and cardiopulmonary resuscitation should be administered. If you suspect a spinal injury, such as from a diving accident, be careful to minimize neck movement. After a near-drowning incident, watch for symptoms like difficulty breathing, coughing, or unusual behavior. These can indicate complications like secondary drowning, where water in the lungs causes problems hours later. To summarize, wet drowning involves water entering the lungs, while dry drowning occurs without water in the lungs but with airway closure. Both situations requiring urgent medical attention and focus on restoring oxygen. In boating emergencies, the priority is to rescue the person quickly and manage their airway effectively. Understanding these differences can help you act swiftly and confidently in an emergency.